Hey everyone, we've got another heart today. This heart would have sat in the chest like this. Superior would have been here, inferior here, left over here, right over here, anterior coming out towards the screen, posterior towards the turntable. So we'll start off by trying to find what looks like a right atrial appendage, at least externally. And it appears that this is probably the right atrial appendage, triangular and broad base. So why don't we just open up the heart there and we'll get started. So let's go ahead and open up the heart. And we do see that there are pectinate muscles that spill outside of the appendage, consistent with the morphologic right atrium. As we look around, we do find a coronary sinus, or the mouth of the coronary sinus here as well. So consistent with the morphologic right atrium. As we look at other structures, we find this oval-shaped structure here, which seems like it may be an oval fossa. Although while we look at this atrium, we do see that it appears to open up to both ventricles. So here's the left ventricle, and here's the right ventricle. So one of two things are happening here. This is either a common atrium, or this is a left and right atrium that really haven't been septated at all. So let's kind of find out what's going on with this structure here, which kind of looks oval in shape and could be an oval fossa. There are two sutures that have been thrown in here that close this structure off, but there's a little entrance by which we can advance our probe. And it appears that when we advance the probe through that, it goes right into what appears to be the left atrial appendage. So this is either a common atrium, or there's a small left atrium behind this structure, but then functionally essentially a common atrium. So a large atrium that essentially is connected to both ventricles when you look down. Once again, here's the crest of the ventricular septum, here's the left ventricle, here's the right ventricle. And when you look at it from this view, you can see that there in fact is a common atrioventricular junction. So this is a heart with an atrioventricular septal defect and a common atrioventricular junction. So while we have the heart like this, we can see that in fact here is the inferior bridging leaflet, and then here we find the superior bridging leaflet. And then of course we actually see the atrioventricular septal defect here. And we can see that really in this heart, there is primarily a ventricular communication only. There's no atrial component to this atrioventricular septal defect. So an atrioventricular septal defect with communication at the ventricular level only. And once again, inferior bridging leaflet that does have connections to the crest of the ventricular septum here, and then, of course, the superior bridging leaflet here. But let's quickly go back to the atrium. Here is the mouth of the coronary sinus. Here is the atrioventricular septal defect, the tendon of Todaro. And so that would form the triangle of Koch, and one would anticipate to find the atrioventricular node here at the apex of that triangle, and then the bundles would penetrate down. However, you can see that because the atrioventricular septal defect sits there, there is no possibility that bundles would be able to course down. So in fact, as we all know, in the setting of an atrioventricular septal defect, the AV node is often inferiorly and caudally displaced. And we would anticipate to find the atrioventricular node likely in this position right here, with bundles then coursing at the posterior inferior margins of the ventricular component of the atrioventricular septal defect. Now we can kind of turn our attention to this ventricle here, which has coarse trabeculations, and there does appear to be a septomarginal trabeculation here. You can kind of see it here. So consistent with the morphologic right ventricle, we can see connections of the right side of this common atrioventricular valve to the septum here as well. And then as we kind of follow this ventricle out, once again, we see the septomarginal trabeculation here. And then we find the pulmonary valve and the pulmonary trunk. When we expose this pulmonary valve, we do find that it is a 2-leaflet pulmonary valve. So here's leaflet number 1, here's leaflet number 2, and there are also 2 sinuses, which we delineated at the same time. So sinus 1, sinus 2, all right? So a 2-leaflet, 2-sinus pulmonary valve, which we often see in the setting of tetralogy or double outlet right ventricle. And so it would be interesting to see where if this is a double outlet right ventricle, and here we find the aorta, and if we trace it back, we actually find, here's the ascending aorta, here's the aortic valve with 3 leaflets. Here's 1 leaflet and 1 sinus, another leaflet, another sinus, and another leaflet, and it's sinus, so 3 leaflets. And we find that the aorta actually does in fact arise from the morphologic RV. So here's the aortic outflow, and then right over here is the pulmonary outflow. So we are dealing with a double outlet right ventricle as well. So this is an atrioventricular septal defect with double outlet right ventricle. And once again, here's the pulmonary outflow, which sits anterior and leftward to the aorta, which is here. All right, so stating it differently, the aorta is posterior and rightward to the pulmonary outflow. And you can see some pulmonary infundibulum here as well. Now, if we go ahead and kind of turn our attention a little bit to this atrioventricular septal defect, we do find that it seems a little more related to the aortic outflow tract. Here are actually the valvar components to the aortic valve, and the defect comes right up to the margins of the aortic valve. So almost a juxtarterial type intraventricular communication. And the actual intraventricular communication is separated from the pulmonary outflow tract by the pulmonary infundibulum. So the ventricular component of this atrioventricular septal defect appears more related to the aortic outflow. Now, why don't we go ahead and take a look at all this from the left ventricular aspect here. So we'll flip the heart over. Here is another ventricle. It does appear to have fine crisscross trabeculations consistent with a morphologic left ventricle. And now we can once again see the atrioventricular septal defect. And remember, in this heart, there's only a ventricular component to the atrioventricular septal defect. And you can see how this produces a scooped out appearance of the left ventricle, which is a hallmark of the atrioventricular septal defect. Which again, here is the superior bridging leaflet. Here's the inferior bridging leaflet here. And you can see that the left-sided components of the common atrioventricular valve are in fact much smaller than the right-sided components of this common atrioventricular valve. And in fact, it appears that the left ventricle is a little more hypoplastic, and so it's safe to call this an unbalanced atrioventricular septal defect as well. So an interesting heart with both an atrioventricular septal defect and double outlet right ventricle.